And then I've worked for 25 years of the 40 years with JBS International. I've now been to all 50 states, some US territories, a number of tribes, and I'm now working with more than 160 tribal grantees as part of the Tribal Opioid Response Initiative. So today we're going to be talking about action planning, and I wanted to take a minute to show you this particular graphic of the strategic planning process, because we won't be covering strategic planning in the traditional sense. Strategic planning is, as you probably know, is a very large involved effort that sometimes can take several days or weeks, and usually involves doing a whole environmental scan and identifying the strengths and weaknesses, opportunities and threats, and assesses that against your mission and your values, and establishes, major goals, initiatives, and objectives, and then identifies the action, and then it's executed and updated. And this usually takes a very long time, and many of you may have been involved in a strategic planning process with your tribe. And so what we're doing today is really what I call strategic action planning, which is a smaller scale way of doing planning. It's more targeted, and it's really more the process of translating strategies and goals into actions, and it allows ideas to become more tangible. So it's a little bit more concrete, a little more narrowly focused. It's characterized by a separate plan for each component, and everything leading to an ultimate goal. But action plans, there's lots of different ways to do this. There's lots of different formats, but most of them share some commonalities, most action plans, and most of them have include an outline of goals, objectives, measurements, action steps, and responsibilities for each action step. Ideally, action plans are connected to a larger strategic plan, or they can just be, like I said, a more abbreviated process that might be more around a special project. And since y'all were doing these special projects as part of your leadership academy, we thought that this more focused, kind of project-based planning approach might make more sense for the efforts that you're undertaking. But it's always a good idea, if you have a chance after the fact, if not beforehand, to kind of align what you're doing with a larger strategic plan. That way it would have more buy-in, greater traction, and greater sustainability than if you're creating some kind of planning process in a vacuum. So the 7 steps that I will be covering, first, defining the problem or the strengthening opportunity. We don't always like to think in terms of problems, and try to think a little bit more in a resiliency focused manner. So perhaps you're aware of something that maybe isn't really a problem, but an opportunity to build on something you're already doing that's strength-based, and you're looking to strengthen what you're doing versus tackling a problem. Either way, the process is similar. You would collect and analyze supporting data. You always want to get a baseline so that whatever you are undertaking in your action planning, you'll be able to prove, well, this is where we were when it started. And then after we, did our action planning, some weeks or months later, we arrived at some improvements or some further strengthening opportunities. And so you have a baseline to show where you started. It always will involve defining your desired solution. So where would you like to take this project, or this effort that you're undertaking in your action planning? That desired future solution is something you would write a goal statement, or maybe multiple goals for. Then you implement the solutions through the action plan, and then you monitor and evaluate it over time. And then, of course, as you evaluate what you're doing, to see, are adjustments needed? Do you need to adapt something? Do you need to increase it or expand it? So these are basically the 7 steps that I'll be covering in more depth during this session. So starting with defining the problem or the strengthening opportunity, there's so many ways to do this, and I realize that some of you have probably already selected what your leadership project will be. But if not, you'll be thinking about, what are the kinds of problems that are happening in your tribe or in your community, or what are the things that are going well that you would like to build on. You can find out about that through talking with your tribal leaders, with the clients of your programs, with staff members, with other tribal members, with referral sources. So there's just a number of sources that you can go to kind of involve in the conversation, to involve in the opportunity to sort of clarify what it is that you're going to tackle. And you might review an existing strategic plan to see, well, what was on their radar, issues that might need to be tackled through action planning, and then consider some priorities. So getting more people involved that are interested in this topic, maybe once you pick the problem or the opportunity that you're going to work on, maybe once that process is completed, you might think about new people to involve. Once you've sort of narrowed it down, that might increase the list of people that you want to speak with to get involved in your effort. The sources for defining a behavioral health problem, whether that's mental health or substance abuse, there's so many places to go. It just depends on who you have accessible in your tribal community, but looking for what stakeholders might be the best to involve. So once you've defined your problem or your strengthening opportunity, and I'm going to walk you through some actual templates to collect this information in a minute. But once you do that, then you want to say, well, what kind of data or supporting information do I have that can really justify that this is what I'm going after and what I'm trying to plan around, that can also help you create that baseline. So you might want to conduct or review any existing needs assessments that you might have undertaken. You might want to contact your tribal epidemiology center to look at what kind of data they might have to support the work that you're doing. You might conduct key informant interviews. And, I know in working with tribes in the past, I'm often told, we don't have a lot of data to use, or we don't know if we trust the data, or there's apprehension in collecting data. But remember that one really important source of information is what we call key informant interviews. Who are the people in the know, whether those are your tribal elders or leaders or tribal members or school faculty or clients themselves or their family members or referral sources, law enforcement, healthcare. There's so many people that have a perspective to lend that just interviewing them is a form of data collection. And again, we call it key informant surveys. They don't have to be fancy. They don't have to be super scientific. It can be something as easy as a couple of questions. What do you see? Let's say the problem that you decided to tackle is that, let's say you have a mental health program and you are not getting a lot of clients. We're experiencing this in our tribal opioid response initiative, that a lot of tribes set up these fabulous programs to serve tribal members with opioid use disorder, but people are not showing up for treatment to the extent that they believed they would show up. So, part of that is, let's get out there and talk to the people that might help us understand this problem better, these key informants, and get their perspective on things. So collecting that information is a form of data collection. Other relevant data would be, as I said, health statistics, arrest data, homelessness, overdose. You might look at trends. Is whatever problem you're wanting to address getting worse? And looking at school and community surveys. What kinds of gaps in resource assessments might you look at to help inform your process? I'm going to show you about 6 slides now that just show various sources of information that you might want to look at to document the problems and to capture a baseline if you're going to be tackling something, let's say, in the mental health arena. This particular SAMHSA slide deals with serious mental illness. Maybe that's not the problem that you're looking at, but by way of example, this shows how dramatically higher the serious mental illness is among adults 18 and older who happen to be American Indian or Alaska Native when compared with other races and ethnicities. So you'll see that, for example, 6.3% nationally of American Indian Alaska Natives are believed to have a serious mental health illness. So if you were wanting to document that in your community, what you might do is actually apply that estimate against your population of adults to see, well, how many would that mean in your community have a serious mental illness? So we call that a synthetic estimate, or applying a national estimate against your population. So this is just one source, and the web link is right there on the slide, and you'll have copies of these slides. If you have not spent any time on SAMHSA's Office of Tribal Affairs and Policy website, OTAP, there's a wealth of information there. And again, the slides that you will have access to will also have the links to these resources. If you have not yet seen the Tribal Behavioral Health Agenda, it's beautifully designed. You'll see the photo of the cover to the right. And also what I like about this is that this particular document had a lot of input from tribes all over the country, and has a very nice way of describing various behavioral health challenges around the workforce, around prevention, around treatment. You know, it looks at behavioral health from a variety of perspectives, and there's nicely written goals and objectives and action steps. So even if it does nothing but spark some thinking or help you look at how to write clear goals, objectives, and actions, this is a great resource for that. And of course, the Indian Health Service behavioral health website also has a number of resources. This screenshot shows that. This was another data source, mental health national.org, which is very, it has what we call infographics, which are really quite interesting, and also are data sources that you can use to kind of estimate some of the mental health challenges that are being experienced in Native American and Alaska Native communities. And then the tribal epidemiology centers. If you're not working with your local, there's 12 of these around the country. And if you're not working yet with them, you might want to see what kind of data they have. Now, this would be more around health conditions and also opioid conditions, but they can be a wealth of information for you. So if you've identified your problem or your strengthening opportunity, you've gathered some data to sort of capture where are you starting, what's your baseline, then you have to think about, well, where do you want to go with this? How do you take that vision of what do you want to do to improve? Where do you want to go to improve? And so that would be defining the future desired solution. What would the future look like if you were able to successfully remedy this problem? And so that would tie very closely to your goals. Your desired future solutions will align with your goals, ensure solutions are reasonable and attainable, and consider barriers and facilitators that will prevent or foster goal attainment. I love this slide. A goal without a plan is just a wish. So this really reinforces the need to be able to really be very concrete in creating what your, how you'll take that vision that you have and translate it into a goal. So consider using the worksheet that's provided, and I'll show you this in a minute, to help you then go from your needs or the opportunities to strengthen to the data sources that you want to use to establish and verify your situation and capture a baseline, dream about or think about where you want to go, and then write your goals. So here's a worksheet, and I'm going to show it to you in a template form, and then I'm going to show you examples filled out. And these are all examples that we will send you after this webinar is over. So you see in column 1, you would write what the needs or problems or strengthening opportunities are, then what supporting data do you have, and then how does that translate to a future desired condition, and that is what will be used to kind of create your goals. So here's an example, and these examples I will illustrate in an actual action plan. And I just picked this randomly because this is a problem that we're seeing all over the country, and whether it's substance abuse, mental health, or even in some cases health, we're seeing issues around how stigmatized these conditions are, such that there are problems sometimes engaging people who have health or mental health or substance abuse needs into the care that could save their life. So let's say a couple of problems here. We're not sufficiently reaching our tribal population of focus. In other words, you have a large out of treatment population, a population of tribal members who need a service, but they're just not coming in for whatever reason. And so what would the supporting data be? Maybe you observe some of these yourself. You're maybe around your community and you see, people that are using drugs or that have mental illness that are hanging out on street corners or at the laundromat or just in the community, and they're not getting better. They're not coming in care. Maybe your key informant testimonies, your tribal elders or school officials or parents are complaining to you. Wow, my kids have problems. They won't come in for help, or I can't get my adult child to come in for treatment. And so you also have your intake numbers. You can look at, well, how many people, from your tribe are accessing care that they might need. And then what would your future desired condition be? Well, you would really want tribal members who are in need of treatment to be aware of the service. And you want to, so one of your evaluation measures might be, or the goal rather, might be to increase awareness of mental health treatment among tribal members. So you can see how we worked from a problem to looking at the data to discussing the future desired condition to creating a goal. And then another one might be that our tribal members have a high no-show rate for their first intake appointment. So maybe they call and make an appointment, but they don't show up. So moving into the next column, what source of data might you use? You'd look at your intake data that would reflect the percentage of intake appointments that were kept versus those that weren't kept by tribal members. So you might know how many were scheduled and then how many people showed up, and hopefully by race, ethnicity, or by tribal affiliation. And so you have a way to measure, wow, we're only getting a 10% intake rate, show rate on first intake appointment. Maybe after you make some improvements, it moves to 30%. So again, you're establishing a baseline. Well, what would your future desired condition be for that? Is that you want tribal members simply to keep the intake appointments that they make. And so that would translate to a nice crisp goal of increasing completed intake appointments among tribal member clients. So you can see how we work through this. I know there's a lot of different ways to write goals and objectives, but typically goals are more similar to the outcome that you want, whereas objectives are usually numbered, how many, by what date, they're quantified, and usually have some kind of timeline. So here's a couple more examples. Tribal members this is another problem you might pick. Tribal members who make it to the first treatment appointment often do not return. Just as an aside, we found out this was happening in one of the programs I was working in. So youth, it was a tribal youth initiative. They were coming in for their intake appointment, but then they never came back. Well, one of the things that we found out was that the intake assessment instrument was so long, it took about 2 to 3 hours to complete. And some of you are aware of this particular instrument. I don't want to name it, but I think we know what it is. And it takes so long to complete that it's exhausting. And these clients, they not only is it exhausting and they feel like they're under interrogation, they're being picked apart, they're being, asked all these very personal questions on the very first time that they meet the helping professional in the intake part of a treatment center. And so not only is that very off-putting and maybe they feel very stigmatized, but also they may not understand that this is not treatment. This is assessment or intake, that hopefully if they make it through that and come back, then the sessions will be more about them, what they want to talk about, what they want to work on. It might be more related to their substance abuse or mental health problem, and it won't be all of this, detailed, invasive questioning that they're experiencing. So let's say that were the problem that you were going to identify to work on in action planning. So the data sources, the supporting data for your baseline might be, what does the treatment data reflect in terms of the first, the people that are from your tribe that come in for an assessment, what percentage of those then go on to keep their first treatment appointment? And then your future desired condition would be tribal members will keep their first treatment appointments. Whatever treatment appointments they make, their first one they will complete. And so again, an easy way of restating that into a goal is to increase the completed first treatment appointments among tribal member clients. And the last example, maybe another problem you pick, is the overall treatment completion rate for our tribal members is less than 30%. So here, of course, I've gone from tribal members aren't even aware of the service or they're not even accessing it, to, some of them make an appointment, but they don't show up for intake, to some of them come to intake, but they don't come back for their first appointment. And this is a fourth problem. And these are all very distinct problems. I'm just using them as examples that maybe that those that do come in and stick it out through the assessment and stick it out for their first appointment don't end up completing, maybe only 30% complete, when the national average is at least half or more. So again, your supporting data source would be the treatment completion rate for our tribal members. Maybe you say what that is, and then you now have a baseline, and maybe you compare it with other tribal programs, or you look at national data to know kind of what you're gonna shoot for. What kind of targets do you want to identify for improvement? The future desired condition in this case would be the tribal members will successfully complete treatment, and the goal would then be to increase successful treatment completions among tribal member clients. So these are 4 distinct examples just shown how you can kind of work it out on this worksheet. And then all of this that I'm showing you here gets sort of pulled into an actual action plan, which I'll show you in a minute. So you can see at the top of this slide, like a little thumbnail sketch of what the action planning template looks like. Again, there's lots of different examples, but this is the one that I use that I find easy to complete. You can Google action plans, action planning templates or strategic action plans, all kinds of different ways, and pull up any number of plans that might be more helpful to you, or that you might find meet your needs better. So I'll show you the larger example. This is the step where you actually take all of that information we've talked about and now commit it to your action plan. So for example, I walked you through 4 goals a few minutes ago. And let's say the goal that you are working on here is that you really want to increase awareness in your community about a program that you've just started, or maybe you've had it in place a long time, but you're not getting the kind of traction that you want. So let's say that's where you would write your goal at the top. you know, you would say to increase awareness of mental health resources in our tribe among our tribal members in need, you know, something along those lines. So that would be your goal. And then you see over to the left, you have, if you were to have that as your goal, there's so many things you would want to do to increase awareness. And I'll walk you through some examples in a minute, but you would have, you know, an objective, you know, so this is goal 1, objective 1.1. And then that objective 1.1 would have multiple activities, you know, activity 1.1.1 and 1.1.2 and so forth. And you can add rows or delete rows. When I send you this template, it's in a Word format, so you can change it any way you want. And so just as a reminder, the activities that you would list here, this is when you're kind of drilling down to the real specific concrete activities that you would undertake in your project. What needs to happen in order to meet your objective? Then the next column, what evidence of improvement would you want to see to know that you're on track? To, you know, kind of like if you don't start getting improvement, then you're not going to meet your goal. So you always want to be tracking and using evaluation data. You know, how would you know if you were making progress on these activities? Who are the responsible parties? You know, you might assign multiple staff to different kinds of activities. Then what is your target date? And then what is your completion date? So this just repeats itself over and over in this template. You may also add columns like what resources do you need to get this done, or what barriers might be, you know, getting in your way, or what kinds of things can you do to facilitate completion. So you can add as many columns as you want, or change any of these. So let's look through what one might look like. So we've now, here we go back to that first example I gave you. Let's say you pick increase awareness of mental health treatment opportunities among tribal members. That's your goal. So there's many ways to reach a goal, many different steps or sub-steps that you would take. So in the case of this, I just made one up that, and again, objectives are going to have some quantified information and a date. So by 6/14 of 2020, implement a tribal outreach model to reach 100 tribal members with mental health disorders. So what I was saying here is, you know, if there's a need to increase awareness among tribal members, then one thing you might want to do is outreach. And again, this is something that we found all across all our various portfolios, is that many grantees believe if we build it, they will come. You know, if we get a grant and we get a program started, that people will just start showing up. And we know the hard way that that's not always the case. Sometimes there really has to be some outreach. And of course, there's so many kinds of outreach you can do. And those steps can go on and on, you know. So I, again, made some up here just for purposes of illustrating how I use this action plan. So I said to myself, well, what would be a good place to start, you know, if I wanted to have, you know, this outreach? Well, the first thing is I would want to interview existing Native clients in my program to identify, well, what's the best way to reach out to people that have mental health disorders from this tribe? What kind of locations are the best to go to? What kind of approaches, you know, would work best? For example, we learned with youth that there's certain places that youth hang out, whether it's in gaming rooms or gaming centers or the mall. There's different places that if we want to outreach to women, especially young adults and a little bit older women, we might go to laundromats, we might go to the beauty parlor, you know. So we go to different places depending on the population we're trying to outreach to. And nobody knows those places better than the type of person that has similar challenges that you're trying to reach. So being able to interview existing clients might be a good place to start. And then moving across the row, what would the evidence of improvement look like? Or what would the evaluation data sources be to let me know if I was making improvement? I would expect to see some kind of interview questionnaire responses. If I were going to interview and take the time to ask existing clients, hey, where did you hang out? What kind of, if we want to get more people into treatment, where do you recommend we go? those very questions that I would be asking, hopefully I've written them down so that I'm asking the same ones to everybody. Again, doesn't have to be involved, can be 3 or 4 questions. You know, where's the best place to go? What's the best way to reach people through face-to-face, through the radio, through social media? You know, what's the best method? What kind of materials would have gotten your attention? You know, what brought you into treatment? You know, what outreach worked for you? So whatever my questions are, I would use, that would be one of my evaluation measures is, let me see what questionnaire you got, what kind of responses did you get, what kind of outreach locations did you identify as a result of that process, and maybe what kind of outreach plan did you come up with. So then that was just one activity. Another activity might be, I might want to hire a peer specialist to conduct outreach, because I know that that's a real successful strategy, to have people that are very much like the folks that I want to get into my program, that are similar in age, similar in demographics, that have credibility to go out and conduct this work. So maybe I hire peer specialists. And so what would my evaluation data source be to know that I'm making progress there? Do you have a job description? Do you have hiring documentation that you brought these people in? Then another activity might be creating a culturally relevant outreach material, or creating outreach materials and methods. So the examples would be, you know, what are culturally relevant outreach materials? You know, examples of those. Do I have posters? Do I have handouts? Do I have, you know, radio clips? Do I have websites? What do I have that would be examples of the outreach materials that I used? And so that would be evidence of my success. Then my other steps might be to deploy the peer outreach. You know, once you hire them, you have to get them out there. And what was the outreach plan and the schedules that would show that I successfully did that? I would want to, one of my other activities is to review outreach contacts. You know, hopefully your outreach workers in this instance would have contact logs, you know, that where they went on what day, what they encountered, how many people they encountered, what the people that they encountered said were barriers to why they weren't coming into treatment. What do they need to make, you know, they need transportation? Are they affected by stigma? Do we need to have a stigma reduction campaign? And we've had in our Tribal Opioid Response Initiative a lot of really cool campaigns that have been developed or that we've learned about. They weren't all developed as part of the Tribal Opioid Response Tour initiative, but we learned about them through that. One was Not on My Reds, and that was a campaign that was done that it's, you know, not okay to use opioids, so not on my res. There was one called the Sober Squad, you know, that it's really cool to be sober, and there's a squad of people, a group of folks that will help you. You know, that is another activity. Okay, and I need to stop here. I just got a sign that says the host has asked me to start my video. Should I ignore that or hit yes, start my video?
Pam, sorry about that. I was trying to stop my own video and then I clicked on yours instead. So depending on if you want to share your own face or if you just want to continue with your slides, just
I'll continue because I don't want to mess anything up. Okay,
yes,
sorry.
yes, just keep going.
All right. You know, so maybe you find out that there has to be a anti-stigma campaign. We also learned in one instance that there were older, you know, some of the tribal elders were coming into to get their pain medications, and drug dealers were aware that this one doctor was coming on the tribe to the clinic rather to give out these pain medications, and the drug dealers would come hang out in the parking lot in order to take advantage of these tribal elders who were there to pick up their pain meds, and they were trying to convince the elders to sell parts or all of their pain medications. So, you know, let's say you learn something like that in your outreach, there would then be lots of more steps that you would have to add to your action plan because this action plan is a constantly evolving, growing document in response to each of these little steps that you're drilling down to that help you, accomplish your goal. So you might be learning new things and adding steps and so forth. And then ultimately, one of your steps might be to cross-reference your outreach logs with your intake records to identify common recipients. So if your outreach log showed that you reached, 20 different people, and maybe you had their names, maybe you have demographics about them and not their names, can you match that up to your intake logs to see if any of them are coming in based on your outreach? Or maybe you add a question to your intake form that says, how did you learn of this program? Oh, I learned it from the peer specialist that I met in my community, So then what would your evidence of improvement be here is your intake records, your outreach logs, and you would look at your number of overlapping recipients. How many of those people did you meet in the community that actually showed up for an intake appointment? And of course, to complete this action plan, you would identify, who are the responsible parties. You might have five different people or many more. You might have a number of different staff splitting up these activities. Maybe you have some people that are better at social media than others and you assign them to those tasks. And then of course you have your target date and then you'd follow up with what date you completed. Okay, so now we move to monitor and evaluate. So let's say you've completed your action plan, it's in full implementation, you're gathering all these data elements and you're being able to determine what's working. So, you want to check in and say, how are you doing? Are you achieving the stated objectives? And we think of objectives as, part of the milestones. If you don't at least attain your objectives, and if you're not accomplishing the level below those, your different activities, if you're not having success there at the activity or the objectives level, then you're not likely to reach your goal. And then you want to document, well, what are the actual outcomes that you are obtaining? You want to consider who should be on the team to help you with this monitoring and evaluation activity. And also, I don't know if any of you have ever experienced any rapid cycle approaches through what's called NIATEX. I gave you the website here and the slide. NIATEX, it's out of Wisconsin, the University of Wisconsin, and it is an incredible resource, a real treasure trove of resources. If you have not yet been to the NIATEX website, and it's spelled NIATX, I highly recommend you Google that, or that you just use the link I gave you here to go to the website. What this does is it's another component that you can use in action planning. One of the rapid cycle changes that I'm most familiar with started out where treatment programs were noticing how many no-shows they had. They would schedule appointments, and then, like I said, a lot of the clients wouldn't show up. And they wanted to go to a walk-in approach, where instead of having to schedule an appointment, and maybe your appointment's not scheduled for 2 weeks, you don't have an opening because you have all these schedules on the books, and then by then the person doesn't show up because they can't wait to come in for 2 weeks. So what this NIATEX would say, before we do this huge wholesale change in our organization and change our policy to from a scheduled appointment basis to a walk-in basis, let's try a small scale experiment. Let's, for the next 30 days, do what we call a rapid cycle approach. And we will test or try this change before we adopt it organization-wide or tribe-wide. Let's test this one little example. And so they would then put a team together. What will it take to, for the next 30 days, try out a new experiment by having walk-in only and not having scheduled appointments? There's all kinds of little tools that you can pull down from the NIATEX website to try this rapid cycle change. And then what you do is you look at the data 30 days later and say, hey, how did that work? You know, we were afraid that by having walk-ins that everybody would show up at once. And hey, that didn't really happen. You know, we got a little busy around lunch break, but for the most part, not only did we not get overwhelmed by walk-ins, but it doubled our number of appointments. And so we really like this. And now let's go ahead and make it, you know, a tribe-wide or agency-wide official policy. And that was just one example I gave you, but you can go to the NIATEX website and it gives you there's all kinds of things you can download, gives you all kinds of ideas for what we call change projects, and gives you examples of case studies of what organizations have successfully implemented these change projects. What did they learn? What did they wish they had done differently? Some experiments went well, some didn't, but they all have things you can learn, and most of them went extremely well. So these are, there's all kinds of goals, all kinds of things there that you'll find that can help you monitor and evaluate your own project that you might want to take a look at. And then lastly, the last step is adjust if you need to and initiate continuous quality improvement. So you can see here that, you know, once you implement your action plan and you're starting to reach your goals, you know, or you review them and you say, you know, we did really well. Let's go back to the example I gave. You know, the good news is we increased our awareness of our tribal members of our mental health program, and we brought a lot more people in. The bad news is we only brought in adults. We were still trying to get adolescents or young adults, and we really didn't have success there. So let's go back to the drawing board and see what we can do, what kind of improvements we might want to make, and give it another try, and then we'll come back and evaluate how those improvements went. So the point of this is that it's continuous. It's in a circle. You know, you develop something, you implement it, you evaluate, you make adjustments. Excuse me, and you go back and do it again. And it's a continuous process. So I want to stop here and see if we have any questions from, you know, about anything I've covered, or if anybody has any examples they want to share of any strategic action planning that they've undertaken.
Pam, this is Annalena. I just want to say something about using NIATEX. I have used NIATEX successful in a couple of tribes. It's really interesting. It engages a lot of the staff in implementing and expressing their opinions. And one of the things that I have enjoyed with NIATEX is, of course, as we do community work in tribal communities, really is trying to find the strength. You know, one thing is all the deficits we are worried about, which is a very important part of doing strategic action planning. But then what is it that we can build on that works and use that in an NIATEX plan or an action plan, I think has been very constructive.
Yes, and that is a great example. And so one of the, when I'm looking now at the NIATEX handbook, and the four most frequently identified projects were reducing the waiting time between appointment and treatment, reducing the no-show rate, increasing continuation, you know, somebody coming back until they get the treatment they need, and then increasing admissions. And most of those are either deficit related or, you know, even increasing admissions, as an example, is not necessarily a deficit focused approach or a goal. It really can be a strength-based activity. So for example, if you knew that, as we've learned in the TOR project, that there are lots of examples, particularly in trying to engage youth, that tribes are having a lot of success around. And that is, creating opportunities for them to learn more about their culture and their language, having more opportunities to bond with pro-social peers, to have, fun activities to do that involve their culture. And so if, for example, you wanted to strengthen outreach, and let's use the example of the Sober Squad. One example might be that you highlight in your community, let's say bringing youth that might already be involved in the Sober Squad or in maybe the Canoe Adventure Program or other kinds of initiatives that are very pro-social and positive that involve bonding and strengthening of culture, and use that as a way to outreach and attract more individuals to your program. We have examples of medication-assisted treatment programs where there's a lot of hesitation among tribal members to come in and take a medication to help them with their opioid use disorder. But in tribes that have added culturally relevant components, like ceremonies or beading or sweats or other kinds of activities that are important to their cultural heritage, when they add those and build on those and weave them in to the other, let's say in this case, medication approach, they have a lot more success. So yes, I agree completely that the challenge is in using NIATEX, because it involves a change process. It usually infers going from a not pleasant state to a better state, making a change. But it very much still can be used to strengthen and build on effective things that are already happening or that you know to be effective. Hopefully that's a good opportunity for your ATTC. Sounds like a great project to me, would be to find ways to take NIATEX to that other level of having a more resiliency focused lens.
I agree with you, Pam, and let's talk about that, because I know that some tribal communities who've engaged with NIATEX have been put a little off by this very stringent deficit focus, but been very happy when they have seen the results because it increases income. If you get more of your clients to come to treatment, you're going to get more income. And that's some of what the tribal communities have really taken to heart.
Right. Yeah, and I gave a presentation the other day in DC, and this tribal elder came up to me and said he did not want to be there. He did not want to come to this program. He did not want to learn about medication-assisted treatment. He said, I admit I was not happy. And he said, after I sat through, I did a keynote. He said, after I sat through that, he said, I realized that was mind-blowing. And he said, I realized that there is a way that I can translate what you just talked about in your keynote in a way that will make sense, that's strength-based for my tribe. And he's a tribal leader. And he said, my goal is to go back, and that would be this week, and start promoting this and using a completely different way of framing this issue. But we were talking about non-stigmatizing approaches. But anyway, yeah, there's so many ways to approach taking, I think the safe way to say is, there's always ways to strengthen and improve what we're doing. I mean, I don't know that there's anything that's perfect, no matter how we all try, but there's a lot. We don't have to start from scratch, and we don't have to just assume everything is a deficit focus. We can look at our own culture and say, what has worked for us for thousands of years? What do we know is, you know, the truth, and how do we take that and build on that and use that as a framework for moving something forward. And so, you know, all of this is very conducive to action planning. It's all how you know, frame it. The trick is being able to track it and show that by, you know, building on the strength that you already have, that you're evolving something forward. Any other questions or comments or any examples that maybe folks on this webinar have had some success with in the past in their own action planning? All right. Well, I hope that this was helpful or at least sparked some ideas. The templates that were embedded in this PowerPoint will be made available to you. They're the worksheets and including some of the examples. You know, hopefully this will help move you forward if you're stuck in any way in your projects with your Leadership Academy. And I hope you all have a wonderful end of the year, and that wish you the best success in your leadership projects.
I have a couple of questions. Thank you so much, Pam, for talking to us today. I have a couple of questions before we hang up. Who's behind the numbers ending in 77?
I didn't hear the last thing you said.
I'm just wondering who of the participants is behind the number 77?
Monica, it's Jane.
Hello, Jane.
Hi.
I'm so happy that you were on here today. Good to hear your voice.
Thank you. It's good. Yeah, same here. Good to hear you, Helene, and the information was good to hear. And I appreciate the closure, which is building upon strengths. I'm a firm believer in that, about resiliency and cultural activities being a strong part of that resiliency, strength-based activities that we need to revive if it's not already in our communities.
Great.
Thank you, and have a happy holiday, Jane.
Have a happy holiday, everyone.
And who is behind the galaxy number?
You asked who has the galaxy number?
Yes.
Hey, Melanie, it said Galaxy 8 because I had to log in on my phone today.
Okay, great. Last, I hope you guys would take a couple of seconds, or it's about 40 seconds, I've been told, to answer the GIPRA survey. It's not obligatory, but we appreciate everyone who will do that for us. Thank you so much for attending today, and have a very happy holiday, all of you.
Bye, everybody.
Bye.
Thank you.
Happy holidays, everyone. See you in the new year.
Bye, Roy.
Bye, everyone. Thanks so much, Pam.
No problem, Kate.